Hello everyone, my name is He Xiangying, and I'm a resident from Peking Union Medical College Hospital. And today I want to share a case of autoimmune GFAP astrocytopathy, diagnosed after long-term diagnosis of Clippers. As we all know, these cases of GFAP astrocytopathy diagnosed after diagnosis of Clippers were rarely reported. Therefore, we reported a 31-year-old woman who presented with 7 years of recurrent headache. Her clinical history, symptoms, brain MRI enhancement features, and response to treatment during each attack were reviewed. And her initial brain MRI, which was did 7 years ago, demonstrated characteristic PEP-like enhancement of protein and cerebellum. Her symptoms resolved completely, and her imaging improved after taking high dose of steroid. Her diagnosis then was Clippers. This is her following clinical course, and we can see each time after the steroid tapered under 20 mg per day, she had new relapse. During her last relapse, she experienced novel symptoms such as fever and psychosis. Her brain MRI demonstrated novel dot-like and linear enhancement in both hemispheres of the cerebellum, semi-over center, basal ganglia, and thalamus, which was different from before and showed characteristic MRI features of some new diseases such as autoimmune GFAP astrocytopathy. So we did GFAP antibodies for her during her last relapse, and her antibody test results were positive in both her serum and CSF. And she obtained relief again after steroid therapy, and her final diagnosis was converted to autoimmune GFAP astrocytopathy. From this case, we know autoimmune GFAP astrocytopathy may mimic Clippers both clinically and radiologically. Even in patients with diagnosis of Clippers, long-term follow-up is essential for necessary diagnosis revision at each new attack, and GFAP antibody test was suggested for differential diagnosis, especially when the patient presents with linear perivascular